This is a presentation about alcohol abuse and alcohol use disorder by Scarlett Minner. What is alcohol? Alcohol is also known as ethanol, which is abbreviated as ETOH. This is a chemical substance found in alcoholic drinks, household products, hand sanitizers, some fuels, and much more. An alcoholic drink contains ethanol in the form of alcohol that is produced by the fermentation of grains, fruits, or other types of sugars. Distilled ethanol and undistilled ethanol can be consumed as alcoholic beverages, and not all alcoholic beverages are created equal. Some examples of distilled ethanol include vodka, gin, brandy, whiskey, rum, and tequila. And these typically have an alcohol by volume around 40%. Undistilled ethanol are beer, wine, and cider, and hard seltzers. These typically have an alcohol by volume of no higher than 15%. When alcohol is ingested, it is a psychoactive drug that acts as a depressant on the central nervous system. The history of alcoholism and alcohol use disorder in the United States. Alcohol use dates as far back as 7000 BC, when fermented beverages were being made in China. For millions upon millions of people throughout history, alcohol has existed for enhancing the quality and pleasures of life. Prohibition became law on January 16, 1919, in attempts to decrease rates of alcohol abuse, prevent alcoholism, drunkenness, and the disorder and violence it could result in. It was also a governmental attempt to legislate morality brought about by the temperance movement. The 18th Amendment prohibited the sale, manufacturing, and transport of almost anything alcohol-related. But there were exceptions for medicinal, quote-unquote, whiskey prescriptions for millions of Americans. The beginning of Alcoholics Anonymous came to be in 1935 in Akron, Ohio, from a meeting between two hopeless alcoholics, one a stockbroker named Bill and the other a surgeon named Dr. Bob. Today, Alcoholics Anonymous exists in 180 countries. In 1970, President Nixon signs the Hughes Act, which is also known as the Comprehensive Alcohol Abuse and Alcoholism Prevention Act of 1970, into legislation, recognizing the need to address the prevention and treatment of alcohol-related problems in the United States. Today, the National Institute of Alcohol Abuse and Alcoholism drives the effort to reframe alcohol use disorder as a medical rather than a moral issue, to study topics relating to alcohol through evidence-based findings. The prevalence and epidemiology in the United States of alcohol use. As you can see from that slide, 29.5 million people in the United States have an alcohol use disorder. In an average year, 140,557 Americans will die from the effects of alcohol, whether this is from chronic use or accidents caused by its consumption. 1 in 10 Americans over the age of 12 have an alcohol use disorder, and out of those are youth aged 12 to 17. This accounts for 3.4%, or 894,000 of the population who have an alcohol use disorder in the past year. Interestingly, during COVID lockdowns, over half of Americans increased their alcohol consumption. These statistics point to the importance of understanding alcohol use disorder as a medical condition and the importance for screening, brief interventions, and referrals for treatment. What increases a person's risk for alcohol use disorder? A person's risk for developing an alcohol use disorder can depend on many factors. In part, these include how much, how often, and how quickly a person consumes alcohol. Alcohol misuse, which includes binge drinking and a heavy alcohol use, over time increases a person's risk for developing an alcohol use disorder. There are other factors that increase the risk of alcohol use disorder, such as drinking at an early age. A recent national survey found that among people ages 26 and older, of those who began drinking before the age of 15 were more than 3 times as likely to report having alcohol use disorder in the past year, when compared to those who waited until age 21, which is the legal drinking age, or later to begin drinking. The risk for females in this age group is higher than that of males. Genetics and family history play a role, with heritability accounting for approximately 60% of alcohol use disorder cases. However, like other chronic health conditions, the risk of an alcohol use disorder can be influenced by the interplay between a person's genes and their environment. This is where the whole nature versus nurture theory plays out. A parent's drinking patterns can also influence the likelihood that a child will develop an alcohol use disorder one day. Having a mental health condition or a history of trauma can also increase your risk. There are a wide range of psychiatric conditions that are comorbid with alcohol use disorder. This is depression, anxiety, PTSD, ADHD, and they are also associated with an increased risk of developing this disorder. There is a strong correlation between alcohol misuse and mental health diagnoses. A bidirectional relationship between the two exists. Studies have shown that the use of substances can shift brain chemistry and temporarily and over time can permanently shift a person's baseline. So this affects their behaviors, their emotions. What are the short-term and long-term effects of alcohol abuse? Depending on how much is taken and the physical condition of the person, alcohol can cause short-term initial effects. These include slurred speech, drowsiness, decreased perception and coordination, distorted vision and hearing, which can in turn impair a person's judgment, mood swings, vomiting, blackouts, diarrhea, headaches, unconsciousness, breathing difficulties, and coma. The long-term effects of people who use alcohol at risky or harmful levels are at a greater risk for health problems like cancer, obesity, high blood pressure, heart failure, stroke, diabetes, cirrhosis, and accidents that can result in unintentional injuries like car crashes, falls, burns, and drownings, and intentional injuries like firearm injuries, sexual assault, domestic violence, and even suicide. The long-term effects of alcohol can also increase on-the-job injuries and loss of productivity, family problems, broken relationships, nerve damage or neuropathy, sexual problems such as impotence and decreased libido, malnutrition, vitamin B1 deficiency, which is a thiamine. And when you have a thiamine deficiency, this can be presented as Wernicke's encephalopathy. And this is an acute neurological condition that is characterized by a triad of ophthalmoplesis with nystagmus, ataxia, and confusion. This is a life-threatening illness caused by that thiamine deficiency, which primarily affects the peripheral and central nervous systems. So we cannot overlook the health consequences of frequent binge drinking and heavy alcohol consumption. This will result in a dependency and or chronic health problems, as mentioned earlier. You can also have impairments in your cognitive function, stomach, esophagus, mouth ulcers, and various cancers. Alcohol is estimated to cause anywhere from 20 to 30% of esophageal and liver cancers, as well as cirrhosis, homicides, epilepsy, and motor vehicle accidents. Recent research on brain development indicates that binge drinking can damage brain tissues and over time impair a person's normal emotional and social development, as mentioned earlier in the risks. So, what are your signs and symptoms of abuse upon assessment? And we can use this CAGE acronym to do that. Alcohol use disorder is a medical condition that is described by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences defined by the DSM-5. To assess for problematic use of alcohol, the clinician needs to establish the use within a 12-month period, and during this time, did the person experience intense cravings, drank more than they planned on drinking, had unsuccessful attempts to cut back, alcohol was consumed in dangerous situations like babysitting, work, driving. They also may report an inordinate time spent obtaining the substance or recovering from its use. Important activities and obligations are given up to use the substance, like avoiding work, parenting, or social and home obligations. A tolerance is developed requiring more of the substance to achieve a level of intoxication, and withdrawal symptoms are present, such as nausea, confusion, tremors, etc. And they need to use the substance to relieve these symptoms of withdrawal. This encompasses the conditions that some people refer to as alcohol abuse, alcohol dependence, alcohol addiction, and the colloquial term alcoholism. The signs and symptoms of a use disorder can be assessed using multiple tools. And this is one of those tools called the CAGE questionnaire. The CAGE screening tool is an acronym that can be used as a quick guide in identifying the presence of an alcohol use disorder, and a positive score is present if a person answers yes to 2 of these 4 questions. We have other screening tools and interventions that we can use to assess the presence of abuse. This is also done by a screening and brief intervention and referral to treatment, also abbreviated as SBIRT, and the audit screening tool. We also need to know the severity. So when we find an alcohol use disorder that is present, we want to know the severity. And if substance use disorder is recognized, we need to do a brief intervention and refer the patient for appropriate treatment. And the resources, also known as, like I mentioned earlier, the brief intervention, is typically a short motivational interviewing session to help the patient recognize the presence of a substance use disorder. So part of this screening, brief intervention, referral to treatment, the brief intervention can be a motivational interview. And we've done that before, and we kind of know how to do that. So, and it's quick and easy. That's, when we're screening people. Additional screening tools are the audit, and this can help establish severity. As you can see, the audit asks questions about severity and gives an example of what an alcoholic drink can look like. Not everyone's idea of an alcoholic drink is the same. That's why we need to know what it looks like. With the help of the audit, we can determine the severity of one's alcohol use and use this for a diagnosis, ICD coding, and guidance and treatment. Severity is based on the number of criteria a person meets based on their symptoms. So at the bottom you have mild, moderate, and severe, and that's the criteria. So you have 0 to 4, 5 to 10, and 11 or 12. Severe is 6 or more. It's important to, when somebody has an alcohol use disorder, we need to know if there are symptoms of withdrawal present. And withdrawal from alcohol can be deadly. So I feel that this is important to mention. When someone has this disorder, we need to be aware of the signs and symptoms. And the most common sign is tremors occurring within hours of cessation of that substance. And this is actually related to the activation of the autonomic nervous system that can lead to hyperarousal, causing unstable vital signs like increased blood pressure, increased pulse, increased temperature. They'll also present with nausea, vomiting, We can use the Clinical Institute Withdrawal Assessment of Alcohol Scale, revised, which is right here on the side. And this can help in determining the severity of withdrawal symptoms when a person attempts to stop drinking or cut back use. The SIWA AR measures 10 symptoms, and scores from 0 to 10 indicate minimal to mild withdrawal, needing close monitoring. 8 to 15 indicate moderate. So this is a mark in arousal of the autonomic nervous system. And this indicates the initiation of interventions. So we'll do a Valium or Librium taper to help decrease that autonomic nervous system response. The assessment requires 2 minutes to perform, and those with a score of over 15 are at an increased risk for severe alcohol withdrawal. So this tool can help to prevent the life-threatening condition, which is delirium tremens. The potential for overdose and being used as a weapon to commit suicide. So part of the screening and treatment and interventions for an alcohol use disorder is screening for the presence of suicidal ideations. Alcohol use has consistently been implicated in the precipitation of suicidal behavior. And alcohol abuse may lead to suicidality through disinhibition, increasing impulsivity, and impairing a person's judgment. Using alcohol can be used to ease the distress associated with committing an act of suicide. And alcohol abuse can be a double-edged sword. So a person may use it as a means of easing their psychological stress, but at the same time, it'll impact other factors which increase their risk for suicide. So this can be dangerous in the hands of somebody who is suffering with depression and other mental disabilities, because it can increase their risk for suicide. The slide on the right depicts what an alcohol overdose or alcohol poisoning can look like. Like any overdose, this is a medical emergency due to the effects of alcohol as a depressant on the central nervous system. So you'll present, somebody with alcohol poisoning or overdose, you can't wake them up, they vomiting, which, increases their risk for aspiration. They have irregular breathing because it's depressing their central nervous system, cold skin. You even have the risk of going into seizures and convulsing with it. So it can be pretty dangerous. So the following will be an example of a care plan for a person found to have an alcohol use disorder. So we'll start with the pharmacological treatment options. Medications are an important component of alcohol use disorder treatment toolbox, and they're often used in combination with behavioral interventions. There are currently 3 medications approved by the FDA, and this is disulfiram, acamprosate, and naltrexone. We also want to keep in mind that we want to treat with withdrawal symptoms if they are present, because we want to avoid delirium tremors at all costs. Like I said, this could be deadly. And there are other, we also want to make sure that if there are comorbidities present, we want to treat those as well, like anxiety, depression, bipolar, because they are highly comorbid with substance abuse, with alcohol use disorder. Alcohol use has consistently been implicated in the medications are an important part. So let's go back to disulfiram. This is an enzyme, blocks an enzyme in the body that is involved in metabolizing acetaldehyde, which is a toxic byproduct when alcohol is metabolized. It will cause unpleasant side effects when alcohol is consumed, such as nausea, vomiting, and flushing of the skin. It is theorized that this helps to deter people from drinking who take it. These effects begin within 10 minutes of alcohol entering the body and can last for more than an hour. This drug should not be given until the person is free from alcohol for at least 12 hours. If this is an option, we need to teach the patients to avoid anything that contains alcohol, like mouthwashes, cough medicines, vinegars. Disulfiram is not a cure for alcoholism, but it does discourage drinking. Naltrexone, which a lot of people are familiar with these days, this can be given as a long-acting injectable like Vivitrol, or it can be taken PO, Revia. It's available in oral and extended release. It diminishes the reward effects of alcohol on the mu receptors in the brain, and this reduces heavy drinking. Naltrexone is also known to reduce the likelihood of returning to drinking by 5% and binge drinking by 10%. These drugs are typically used to increase abstinence. Intramuscular is typically a better choice due to the steady state of the medication, and a patient could choose to skip an oral dose if they decide to drink. So obviously the long-acting injectable is the better choice. Unfortunately, cost can be a problem. It can cost up to $1,500 a month to have this drug. I know the VA pays for it for some people for Vivitrol, but the civilian population may have to pay for it out of pocket. So it's a better choice, but it can be more expensive. Acamprosate reduces the negative emotional state associated with extended abstinence from alcohol, and it can reduce the cravings, making it easier to maintain abstinence once it is achieved. So a person has to achieve abstinence before we start them on this drug, because it maintains their abstinence. So they have to be abstinent of drinking before we start this. A randomized clinical trial has shown that other medications approved for other indications, including seizures like topramate, have been effective in treating alcohol use disorder. So we got to keep that in mind as well. And then, like I mentioned before, if a person is having symptoms of withdrawal, a short-term taper of a long-acting benzo like Valium or Librium, and an adrenergic medication like clonidine should be used to minimize the autonomic nervous system rebound that could be potentially life-threatening. And we determine that by using the audit screening. And there are other screenings we can use to assess withdrawal. And clonidine is going to target that tachycardia and the blood pressure. It should be noted that a study randomly assigned 170 depressed patients with an alcohol use disorder and added the treatment with an SSRI for 14 weeks found that the combined treatment group had a significantly higher rate of abstinence for a longer period of time before relapsing to heavy alcohol use when compared to other groups that had monotherapy or none at all. So let's not forget to treat the comorbid conditions. I mean, we have this in our arsenal, so it makes sense to use it. Non-pharmacological treatment options. So most patients think of support groups like AA and inpatient rehab when making decisions about being sober, but there are other options. We have cognitive behavioral therapy, motivational therapy, marital and family counseling. The marital and family counseling incorporates spouses and family members into the treatment process, and this can play an important role because it helps repair the damage that has been done to those relationships because of the heavy drinking by the family member. And it also increases a person's chances of maintaining abstinence compared to people who do just individualized therapy themselves. CBT, we know the benefits of CBT. It focuses on, the cues that lead to heavy drinking, managing your stress, your coping strategies. And the goal is to change the thought processes that lead to the alcohol misuse to develop the skills necessary to cope with everyday situations that might trigger problem drinking. And then motivational interviewing, we can't forget the importance of motivational interviewing for us because it's so quick and easy. And all we're doing is helping them see that, there is a possibility that you can get better, on a scale from 0 to 10. Where do you see yourself wanting to be sober? And you always want to ask them 2 below. If they say 8, why didn't you say 6? And make them think about why didn't I want to be at a lower chance of being sober. So That's the non-pharmacological. And then this is just what Alcoholics Anonymous looks like, the 12 steps, the coins you can get when you complete so many months of sobriety, and the serenity prayer that goes with them to help them accept the things they cannot change, which is a big part of coping. So, understanding when alcohol use has become a problem. We've got to educate these people when it's become a problem. And alcohol abuse, when your drinking patterns result in significant and recurring adverse consequences, you may be abusing alcohol. People with alcoholism, technically known as alcohol dependence, have lost control over their alcohol use. The causes of alcohol-related disorder can be associated with genetics, physiological, and social factors. We have to let them know this. We have to let them know that heavy drinking can lead to a multitude of health problems. Over here to the right, that shows you all these health problems, as mentioned before: heart, pancreas, brain. I mean, the list goes on. Cancers. Do you want to be healthy and live or not? Knowing when to seek help and recognize a problem exists can be the first step in sobriety. To help increase insight, we can educate patients about the signs of a possible problem that include having friends or relatives express concern. And this is your cage again. Being annoyed when people criticize your drinking, feeling guilty about your drinking and thinking that you should cut down, finding yourself unable to do so, or needing a morning drink to steady your nerves, like an eye-opener, to relieve a hangover. There are several approaches available for treating alcohol addiction, so no one approach is best for all individuals, and this usually requires a multimodal approach to reach complete remission. It should be mentioned that relapse is part of sobriety, so no shame, blame, or guilt should last too long. Just like any other disease, exacerbations happen. Referring patients to the proper resources is of utmost importance when treating alcohol use disorder. Referrals to treatment programs will provide patients with group, individual, and family counseling services in an outpatient, inpatient, or residential setting. Some offer full services to cover mental health and medical care and other support. There are 4 basic levels of care, and they are outpatient, which consists of regular office visits once or more a week for several months for counseling, medication management, or both. Intensive outpatient, or IOP. This is coordinated outpatient care. This can last for weeks to months for people with complex needs. I mean, you can do substance, you can do mental health. You have residential inpatient rehab programs that can last for several weeks at 24-hour treatment settings. And then you have intensive inpatient, which is medically directed 24-hour services that can last several days to weeks, usually used to manage withdrawal and receive other treatments. We want to refer to therapists for their CBT. These therapists are experts in different types of behavioral therapies and in treating addiction, and they can support people with problems with alcohol and help them in several ways. They can help clients set goals, develop skills to cut down or stop drinking, manage their stress, and build a strong social support. They may offer one-on-one, family, or group sessions once or more a week. And let's not forget us in this, psychiatrists, their PCPs. Their PCPs are going to play a huge role in this. A referral to a primary care is needed for patients to have thorough care, to include a physical exam to assess for all of their health issues that can accompany an alcohol use disorder, like all the stuff with the heart stuff, liver, all the stuff we mentioned before, pancreas, or any other medical conditions that may need managing. This is a holistic and collaborative approach because PCPs can perform motivational interviewing just like we can to help patients in their journey in making changes. Psych NPs and psychiatrists are providers that specialize in addiction and are well prepared to care for patients with more than one mental issue, like PTSD, depression, anxiety, bipolar, schizophrenia, just to name a few of the comorbidities that frequently occur. They're also able to prescribe the medications that can help a person in maintaining the sobriety. Like I mentioned before, the naltrexone, the acamprosate, those medicines. And then follow-up is going to be important as well. As providers, screening, brief intervention, referral for treatment. We've got to continue to do the SBIRT. I cannot say this enough about continued screening and intervention. Don't forget motivational intervention and how quick it can be done. As providers, we can't be too quick to think the patient is stable and out of the woods. A common mistake is assuming that they are out of the woods and on the road to recovery. Less than 20% of patients remain abstinent for a full year. Relapse is part of the sobriety journey. If the patient has a relapse, find out what happened to formulate a new treatment plan. We want to ask them, what were the circumstances that surrounded it? What triggered it? How did you feel about it? Do you have any social support systems to get you through that? That's why AA is so important. And having sponsors. They should have a list of numbers of people that they can get in contact with when they feel like they want to relapse, when they want to pick up that drink. They need that to cope with. And do they feel like they can quit again? Psychoeducation is so important because it helps with long-term sobriety. Let them know about the science of addiction. 60% increase in susceptibility just because they were born with the gene. Addiction changes a person's brain chemistry. It rewires their brain's reward system and causes tolerance, dependence, and intense cravings. They need to know this. They need to know that they are not responsible for this. Yes, they are. They can be accountable, but genetics and brain chemistry is going to play into it. The psychoeducation also helps a person understand the relationship between the substance use and their mental health, the risk factors of each that may overlap, and how treating both conditions simultaneously can be the most effective. So treat the comorbidities that come with the addiction. It's also important to make sure that the patient is following through with the referrals to see a PCP. Due to the high incidence of the adverse effects caused by long-term and excessive alcohol intake, like heart and liver diseases, treatment does not end with recovery. Recovery means that a person can handle the stressors of everyday life without using alcohol to cope. The patient must develop and rehearse strategies to cope with high-risk situations. This is why reinforcing 12-step programs and continued CBT is so important, as well as follow-up appointments to assess where they are in their journey. So it's so important to continue to screen, brief intervention, referral to treatment. Continue. Relapse is part of the journey. Keep educating them about the genetics, the chemistry of the brain, and how it's changed. Are you attending your groups? Are you attending your therapy? You got to keep reinforcing that, because this is a collaborative approach. It's not just us that are helping them with this journey. And they have to follow up their PCP, because there are other things that are going to be managed with this. In conclusion, it is easy to see how alcohol can disrupt a person's life. As mental health psychiatric nurse practitioners, we have the training and knowledge to treat this population. It is our duty to understand addiction and the role we have in treating addiction disorders. I hope this presentation enlightens you about alcohol use disorder and the part we can play in a person's journey to sobriety and recovery. Thank you for listening.